lockdown begins to ease, we are all asked to practice social distancing, which, when you have sight loss, can be a struggle. Seeing supermarket markings or how far away the person is in front of you is not as clear to a visually impaired person as it would be for a fully sighted person. We have Denise Wilkinson joining us from Zoom as she talks about the challenges she and others with sight loss are now facing. So hello Denise, thanks for joining us.
You're very welcome, Natalie.
So first of all, just to give a little context to the challenges you may be facing, do you want to just tell us a bit about yourself and your eye condition?
So I'm a Galloway service user and a volunteer. I have macular degeneration. I was diagnosed in 2015. I'm registered severe sight impaired, and when I look straight ahead, it's like I'm looking through a misted, fogged up, steaming mirror all the time.
Following the lockdown, how often have you been going out?
During the lockdown, I would go out maybe once or twice a week with my son. I wouldn't access big supermarkets. I would stick local. Now, lockdown's eased a little. I've been out probably the same amount of time. I have been into St Anne's, but I'll go earlier in the day to access banks because it's not as busy. Because even with my son, I'm a little bit more nervous if I'm truthful.
So how safe have you felt going out?
Oh, I'm more nervous now lockdown has eased. Because after weeks of frustration, there seems to be more people, and they always seem to be in a rush. I'm very impatient in queues. People can walk in front of you when they're holding their phones. And people wearing face masks, they seem to come a lot closer, and that can make me even more nervous. It's almost like you're on your guard all the time, trying to stay safe and follow the government guidelines.
And what challenges do you face when you're going out to do your shopping? Like, can you see the signs and markings? Do you ask for assistance, or do you need someone there for you, like your son?
I haven't been shopping on my own yet. I don't feel that confident to take that next step just yet. If I can't find something, I will ask for help. And also, if there is no store member on the door, I will always ask them, is it safe to come in? I can't read signs on the windows. My colour vision is very poor, so I rely on contrast. So I've struggled with the grey gaffer tape type distance markings on the pavement and the white lines. I can't see those. I definitely can't see over there. The one-way arrows round the shop floors are difficult to see for anybody with low vision. Another problem that I particularly have noticed is the hand sanitizer stations, clear bottles on a white table or a white tablecloth. I can't see them, so I've now started carrying my own. The big one for me is being told the one person rule in a store per household, even with a white cane in my hand. That was soul destroying. I shouldn't have to explain I've got sight loss and why I need help. And for those living alone, they've had to rely on family, neighbours and friends to go shopping for them, collect essential items. Not everyone has access to internet shopping, and if they weren't in the shielding group, it's been really, really difficult.
So do you feel that you've lost your independence a bit now with the social distancing?
I've lost confidence. Yes. Yeah, it's almost like I've been pushed back on to the very first run of the sight loss pathway all over again, and it has affected my confidence and my mental well-being. Yes, very much so.
And have you been going on public transport like buses or trains?
I haven't been on public transport personally yet, but I have thought about this. Would I know what seats I could sit on? Would there be other passengers sticking to the face masks rules? How would I know that the bus isn't so busy, that's why it doesn't stop? And would I feel comfortable being on a 35-minute bus ride journey into town at this moment in time? I don't think so, not just yet.
No. And I know plenty of other people that would probably feel the same as you as well, which is such a shame.
I mean, I've got an underlying health issue as well, so that makes that issue, you know, that being in that enclosed space for 35 minutes is the one.
Of course, yeah, yeah. And how do you think the impact of social distancing has affected guide dog users, as guide dogs may not really understand these social distancing rules?
Well, guide dogs aren't trained to social distance. They can't read signs and arrows that let them know the safety rules. People in queues, there's queues and there's more people meeting outside. So these are, again, added obstacles. I'm not a guide dog user, but I do know people who are guide dog users and they haven't been out for 15 weeks apart from to the end of the road. So that leads to social isolation and loneliness.
Of course, yeah. And what sort of support and information have you been given, or do you think there is for the people who are struggling to get out and adhere to these social distancing rules?
2020 has become the year of Zoom. Telephone group calls, community members phoning each other to say hello and check everything's okay. The information I've been given has been from Roving Services at Lancashire County Council. Galloway's have called, Macular Society and Disability Equality Northwest. It really has highlighted the importance of networks working together. You know,
yeah, we all need each other, and we all need to raise awareness of what these social distancing rules are like and how it impacts people with sight loss. I mean, what would you like other people around you to do or to be aware of?
But to say it's okay to come into a shop rather than wave, that's a big one, because people just wave you on and I can't see that. Be aware of when you're out and about with people with long canes and guide dogs, and give us the space we need. Be aware, be patient, and be safe.
And is there anything else you want to add?
Many blind people are reliant on sighted guides, and that's almost impossible during this pandemic. Because they're reliant on people linking arms, and they can't do that because of the social distancing rules. So again, that's led to people staying indoors, not going out, and feeling very lonely and isolated. It's having a big impact on mental well-being.
Definitely, yeah. I mean, the overall message around the coronavirus and lockdown is about mental health well-being, because a lot of people live on their own and they rely on other people, and if they're not able to go out and be with other people and have sighted guides who obviously rely on touch, then it has such a detrimental effect on people, isn't it?
Yes, because especially when you're shopping, if you're visually impaired, you do tend to have to pick up an item and bring it into your usable sights better, and then use a magnifier. You can't do that, so it's impossible. Yeah. And the other thing, in regard to social distancing, You know, most people are very kind, and some people will avoid you, but people still think I can see, and I can't see them until they're well within my 2-meter bubble, and that's really, really frightening. You know, it really, how people react to you and moving at the last minute, it's frightening.
Yeah, you're relying on other people to adhere to the rules. So I think the message we want to get out there is for people to be just more aware and to be understanding and compassionate and think about the fact that there are people with sight loss who do need that extra space, or do need verbal guidance in
Yes.
a way, just to help them, really, without touching them and without invading their space.
You sometimes almost feel like you're in the way when you're out and about, but it's not only about me staying safe, it's about the person who's walking in front of me staying safe. You know, we all have to stay safe.
Of course, yeah. So that's the message. We all want to stay safe and obviously look after each other and support each other. Well, thank you very much, Denise, for taking the time to speak to us. We appreciate it, and take care and stay safe.
Thank you very much indeed, Natalie.
Thank you. Here at Galloway's, we have compiled our top tips on how to abide by social distancing rules. Number 1, letting people know you have sight loss and may need extra guidance would ensure people around you are more aware of your circumstances. Most people will be aware if you have a guide dog, but there are also other indicators, such as a symbol cane, a sunflower lanyard, or a high-vis vest. Number 2, a long cane is more obvious to the wider public and should make people more aware. You may even want to purchase a longer cane to reach further. Make sure your arc is wide enough and add an extra tap to check your shoreline. This creates more noise and it will help people hear you coming. You could also increase your arc width as long as you don't compromise your safety. Keep to the inner shoreline away from the curb and let others step out into the road rather than yourself. Make your path definite and clear. Number 3, if you think someone is too close, tell them you have a visual impairment and ask them whether they are at the correct distance. When they answer, you can also determine their distance from how far away their voice is. Number 4, if you are using public transport, ring and book assistance if possible. Ask someone to talk you through the new layout and rules. If possible, try to go out during quieter times to reduce the amount of people you may come into contact with. For example, Lancashire County Council's sensory impairment team is offering blind or partially sighted people individual training at Preston bus station to get you comfortable with the new layout. Anyone wishing to discuss this can call 0300 123 6720. Number 5, the government now requires people to wear face masks on public transport, such as trains and buses. The rule is less strict for taxis, but some taxi drivers may refuse you if you do not wear a face covering. It is best to check their rules before you travel. Number 6, you must also wear face masks when attending hospital as a visitor or patient. You may be exempt from wearing a face mask if you have a physical or mental illness or a disability that means you cannot put on, wear or remove a face covering. Children under 11 also do not need to wear a face mask. Number 7, we must now all wear face masks in shops. There is no ruling that you should wear them in a pub or restaurant as you are eating. However, face masks can help us protect each other and reduce the spread of the disease if you are suffering from it but not showing symptoms. But they are not a substitute for social distancing or washing hands. Number 8. Many places, such as shops, hospitals, opticians, and GP surgeries, have been adapted to ensure people can remain 2 metres apart. They will have social distancing markers, one-way systems, and a new layout. So perhaps ring ahead and inquire about these changes to see if you would require assistance. If possible, try to go at quieter times. Number 9. As you may rely on touch, such as feeling for doors, lampposts, and bus stops, wear long-sleeve clothing or gloves to limit skin contact. And finally, number 10. Get into the habit of washing your hands thoroughly before going out and when coming back home. Make sure you disinfect your long cane as it has come into contact with the ground. If anyone approaches you to stroke your guide dog, politely remind them that your dog is working and must not be touched due to social distancing.